Trying to keep you informed on WMTR 1250 AM, WMTRAM.com, and TalkStreamLive.com. I'm Jessie Freeze. Julie Briggs and I host the award-winning Your New Jersey Connection and Ask the Expert, the longest-running ahead-of-the-curve talk shows on the station and in the state. If you suffer from debilitating back pain, you're not alone. 9 out of 10 adults experience low back pain at least once in their lifetime. Patients who suffer from chronic back or neck pain often struggle just to get through a day. When non-surgical options fail and the discomfort gets too much, it's time to select a surgeon with a proven track record, the best hospital rehabilitation program and follow-up care plan for a pain-free life. Joining me this morning on Ask the Expert, an expert in his field, board-certified neurosurgeon Dr. Jonathan Baskin. Dr. Baskin received his Bachelor of Science degree with honors summa cum laude and Phi Beta Kappa from Tufts University, his MD from Johns Hopkins School of Medicine, his postgraduate training, Maricopa Medical Center in Phoenix, Arizona, and his residency training was completed at the famed Barrow Neurological Institute under the guidance of Dr. Robert Spetzler, and completed clinical spine surgery fellowship with Dr. Volker Sontag, also at the Barrow Neurological Institute. Dr. Baskin has been a long time with Morristown Memorial, Overlook Hospital, and Newton Hospital. Dr. Baskin is currently president of Atlantic Neurosurgical Specialists and is a member of the American Association of Neurological Surgeons and the North American Spine Society, a fellow of American College of Surgery. He specializes in complex spine surgery, tumors of the spine, minimally invasive techniques of spinal decompression and fracture stabilization, as well as image-guided neurosurgery for brain tumors and spinal stabilization. And it's so good to have you join us this morning from Atlantic Neurosurgical Specialist, known as ANS, Dr. Jonathan Baskin.
Thank you very much. It's nice to be here.
As we said, it's very difficult to live with back pain. What are some of the most common causes of back pain that you see in your practice, Dr. Baskin?
Well, as you said, it's really a very common affliction, and there are some patients who have a problem with chronic back pain over many decades. They've been struggling, and finally it reaches a point where they seek medical attention related to it. Alternatively, there are some patients that will acutely develop a problem related to some injury, sports or work or otherwise, and so they get fast-tracked more to a neurosurgeon for that reason.
But it is one of those common medical problems.
That is a true statement. In America and perhaps the world, back pain is one of the most common issues that affect adults.
And it's cause for losing a lot of work.
Certainly the economic and social consequences of it are quite substantial.
So you'd say the most common cause is due to muscular strains, which cause muscular tears, which causes the pain?
Certainly in the acute setting, that would be one of the more common issues. Patients can also develop fractures of the spine, of the vertebrae, the bones that make up the spine, and that can be the basis for a lot of debility. In the aging population with osteoporosis, compression fractures are a very common problem that will lead patients to come to the emergency room or prevent them from really being functional in their day. And that's one of the very gratifying things to be able to take care of, to alleviate pain but also allow people to re-engage in their life.
Right. And separating the wheat from the chaff, how long does it take back pain to turn to chronic back pain? When do you know you've crossed the line?
That's a good question, and I don't think that there's necessarily a clear answer for when you decide something becomes a chronic issue. I would say that if you've been suffering with regular pain for more than a year, I would certainly consider that a chronic issue, and really it impacts a quality of life that oftentimes leads patients to seek the medical attention. But it's a matter of opinion how bad the pain is and what you're having to give up because of the pain, whether or not you feel or the patient feels that they want to seek medical attention.
We've heard so much about herniated discs. I hear that all the time. Why do so many people have that? Is that getting more prevalent?
Certainly herniated discs are a very common problem, and it's interesting to note that many people have herniated discs that don't necessarily cause symptoms. So I think it's fair to say that it's an age-related phenomenon, that is, you look at patients, and as they progress through the decades, if you were to do MRIs of their back, you would see that the incidence of herniated discs increases as you get older. It's a wear and tear type phenomenon. But many patients are able to live with herniated discs and don't require surgery related to it. It would be a mistake to think that everyone with a herniated disc needs to have a back operation. And I think one of the reasons that patients may choose to live with chronic back pain, for example, is because they're fearful of being told that they need a back operation. And it's probably reasonable to say that everyone knows someone who's had a bad experience
Absolutely.
with a back surgery. So I think that to some degree it's maybe some misinformation and an element of anxiety that keeps patients from seeking medical attention that really could be helpful to them.
So would you say they're medicated themselves with over-the-counter or prescription drugs?
I think that...
And are they helpful?
Well, you certainly see patients who arrive at different ways of taking care of their pain. In many instances, as we mentioned earlier, if it is a matter of muscular strain or sprain that leads to the back pain, taking anti-inflammatory medications can be helpful with that. But for a chronic pain problem, taking prescription medications over a long period can lead to other medical consequences or addiction. You certainly have patients that self-medicate with alcohol or other substances just to try to get through their day. And again, just the cumulative cost of living with this particular problem, either because of the economic hardship of not being able to keep a job or just the choices that patients make to try to push through the day, there can be long-standing health consequences.
And not only that, it's very interesting that you talk about that because so many of the drugs today have side effects that are just absolutely scarier than the disease or the illness itself.
It is true that a lot of times the cure can create its own problems.
And doctor, if you have a back injury, how do you treat it? Let's talk about surgical versus non-surgical.
I'd say that the majority of patients that come through our practice with the problem of back pain don't wind up needing a surgery, or at least we treat them without having to employ surgery. And things like physical therapy, strengthening the abdominal and the lumbar musculature, anti-inflammatory type medications, judicious use of pain management, consultations for consideration of injection therapy, either into the joints of the spine called facet joints or epidural steroid injections. It's really the minority of patients that have to have an operation to address an acute back problem.
So there's a lot of options to help before you actually do the procedure.
That's absolutely the case.
Now, we understand Atlantic Neurosurgical Specialists, of which you are president, handles the most minimally invasive spine surgeries in the state. Why do you think more people gravitate to your practice more than others? And I have heard this.
Well, we do pride ourselves on taking a very conservative approach of offering surgery in the first place. So I think that the physicians who refer to our practice understand that patients will be given every consideration to avoid surgery before an operation is proposed. And we are very skilled, myself and my associates, in doing these minimally invasive surgeries that are less traumatic to the soft tissues or surrounding the spine, which translates into patients being able to leave the hospital often in the same day.
Yes.
And can return to work in a much more rapid timeline than going through a more conventional so-called open surgery.
Modern technology certainly has taken leaps and bounds. I mean, who would think you could leave the same day years ago?
Right, well, just in the way that appendixes can be performed through a minimally invasive approach, or gallbladders can be removed in that manner. We now have the technological abilities to access the spine through very minimal openings. To do a herniated disc type procedure, we can do that through an approximately 1-inch incision, which, again, thinking years ago to how the back used to have to be opened to access that anatomy, it's really quite remarkable.
It certainly is. With technology, has really taken us a long way. And just tell us very quickly about ANS before I take this caller. ANS seems to be the answer for a lot of people today.
Well, we are now a 12-person neurosurgical group who really offer the gamut of neurosurgical services from spine and brain tumor and vascular type issues. We pride ourselves on being able to really address any neurosurgical issue that a patient may walk through the door, and really have over 52 years of historical experience in terms of the practice existing in the state. So,
And where are your headquarters? Because I know you've been with Morristown Memorial, Overlook, Newton. Where are your headquarters for ANS today?
our office is based in Morristown on Madison Avenue. The address is 310 Madison Avenue, and our telephone number is 973-285-7800.